My name is Jenna, and I'm one of the managers here at the clinic. So I started volunteering at the clinic in April of 2013, and about a few months later in August, I got hired to be a staff member in reception. And, over time, my responsibilities grew, and eventually I got promoted to be one of the managers. So I came to Israel on a volunteer program with a focus on social justice placements. And I had a background and experience in public health, and I knew that's what I wanted to pursue. And I was really interested in working with the refugee population here in Israel. So I heard about this clinic through somebody and got in touch with them and started volunteering. Actually, it is something I've, at least over the last couple years, when I realized I wanted to focus my career on public health, this is an ideal opportunity to really be exposed and be right in the trenches of it all and work directly with patients and with staff and in like a multicultural environment. It really, it all worked out. I never thought that I would be here in Tel Aviv right now, the manager or our manager at this clinic, but I guess you could say it was a new dream come true. So. Balagan. No, I'm kidding. I mean, it is. It's crazy. It can be really chaotic, but it's wonderful at the same time. It's a place where we can help thousands and thousands of people that wouldn't otherwise receive medical care. And, we really go above and beyond just clinical care, which I love about it. We have so many different health promotion and disease prevention activities and programs and workshops, and we're really trying to impact the whole community, not just individuals. Let's see, a lot. My main responsibility is managing reception, so overseeing the staff that work in there and all the different procedures and protocols that we have, handling unique patient cases when they come in, making sure that they receive the care and follow-up treatment that they need. But I also help develop and manage other programs that we have here in projects, with public health and health promotion and working with the doctors, working directly to improve the patient care when they come in, a lot of different things. So one thing that we try to do is identify cohorts of patients within our whole patient population and target them for different health promotion activities and awareness and education. So for instance, we have many, many pregnant women and new mothers. So we help develop workshops on, pregnancy and breastfeeding and infant health and safety and all of that. Same thing, we have groups of patients that are all, let's say, have diabetes or asthma, and then we can target them for different workshops that we have and events to really help those patients learn about what they have and what to do and how to stay healthy. Oh, for sure. The patients are different. The resources are different. The whole organization of it is different. We're dealing with patients that don't have health insurance, for one. A lot of other clinics, I would say the majority out there, at least in Israel and other Western countries, are for insured patients. So in a way that can limit what we can do for them, the services that they can receive. They've all gone through really crazy experiences to get here, to be in Israel right now. And so they're unique, and a lot of them might have post-traumatic stress disorder or have gone through other physical or emotional abuses. So, we take that all into consideration. Plus, they're coming from totally different cultures and countries. They're not Israelis, they're not Americans, they're not even Europeans. So the cultural differences are vast, and we need to really consider that when we provide patient care for them. So it's really important the doctors and all the staff here are aware of the cultural differences and, adjust their style accordingly. Wow. I really like the multicultural nature of it, the staff and the patients. It's really incredible to work with multinational, multilingual team. It really makes it a rich environment, learning all the different languages and customs. And like I said before, I really like that we go above and beyond just clinical care and can, really impact the community on a different level with all types of health promotion and public health activities and events. I think the hardest thing for me is that we cannot help everyone and we cannot help every problem. So, there's times when I really can get frustrated because we just can't. We don't have the resources or the capacity to handle every situation and every problem. And we deal with patients that are very distressed and might get upset and angry, and that can really be hard. And that's, again, the nature of the clinic, the nature of working in a nonprofit, the nature of this unique place. But I just try to think of how many people we do help and how many lives we do reach and we impact positively, and it's rewarding. It teaches me patience, strength, trying to stay strong and calm and handle situations for patients or people that are in much less fortunate situations than I am. It teaches me the power of human kindness, and it's the staff here are so wonderful and such a team and really here to help the patients. Most people here are volunteers, and it's really incredible to see a community come together and be able to provide what we do here at the clinic with such little resources. So it teaches me that this is, cliche, but that we can do something huge, that you don't need, with creativity and with imagination and with using the resources that you do have and not thinking about those that you don't have, you can really put together something incredible. And I think this clinic is a phenomenal example of an organization that can have such a large impact with so little resources, human resources, time, and all of that. So one thing that is really impressive about the clinic is how we grow in terms of what we can do and what we provide and the care that we can give. I feel it grows exponentially, especially since the time I started here as a volunteer. I can't even begin to explain how much has changed and improved for the better. So in terms of the future, it's endless possibilities of how far this clinic can go. We've come from just a handful of volunteer family doctors to having a incredible urgent care center with full-time staff, and we can do ultrasounds and x-rays and stitches and take care of patients that have diabetes and asthma and other chronic disorders. And we have a whole pregnancy clinic. Part of our clinic handles all the women that are pregnant throughout their entire pregnancy. So in terms of the future, I just feel that the possibilities are endless in terms of what more we can do, what doctors that we can hopefully get to come volunteer for us in the future, what tools and equipment we can somehow get our hands on, and then provide even more care. Maybe one day they'll be able to do surgeries here, or we'll have a whole dental clinic, or we maybe deliver births. I don't know. We'll see.